Okay, so how do I start this? Welcome. So most of the people that are probably going to watch this are friends and family. But those of you that find this in the YouTube spheres, um, my name is Aura Michelle, and I am 27 years old, and I came out um, last spring as trans. And so I'm going to be trying to, at least for the first year, post videos that are like sort of like monthly update videos now that I've started HRT. For those of you who don't know what HRT stands for, it's hormone replacement therapy. So for me, I am on two different medications, um, and I meant to have them here so that I could tell you what they were. I guess that'll be next month, because I don't have them in front of me. But so I have one medication that blocks testosterone production, and then I have the second, which is basically external estrogen that I take. I'm going to try to look at the camera here because this is on my phone. Um, so yeah, and like I said, I want to try to do sort of month to month updates of like how the hormones are affecting me, what's new, what's different, that sort of stuff. Um, I also kind of want to do more stuff on YouTube, really. I'm eventually going to get an actual camera and not have to use my phone anymore, which would be awesome. Um, but I mean, this is month one, and it's not really anything exciting. There's nothing new. There's not a lot of changes yet. Um, so like the first thing I noticed, and it's something that the nurse who I'm doing my hormones with said that a lot of her patients notice first, is that my skin got a lot softer, and it's still getting softer. So that's really cool. So my skin's getting softer. I've noticed uh, body hair um, isn't growing back as fast or as thick, which is really nice, especially on my face. Like my facial hair is one of the really big dysphoric things for me. Um, Mostly because my facial hair is very dark and I'm very pale. So even when I'm completely clean shaven, there's still shadow that you can see. But even with just being 1 month on hormones, I've noticed that the hair's a lot thinner and lighter and doesn't grow back as fast. Um, so I'm assuming that's only going to increase as I get more on hormones, as I go farther on hormone treatments. Um, and eventually I'll probably get laser hair removal or something, electrolysis, something. Um, but that's further down the road. Um, the other big thing is twice so far now since I started hormones, I've had 2 days where I had sort of like estrogen surges, is basically what it. I guess is the best way to describe it, but it's basically like PMSing, um, which is something that will happen to me eventually once my hormone levels sort of level out and get to where they're going to be. I will PMS once a month, which will be exciting. I can't wait. Oh God. Um, but yeah, so I've had 2 days so far, or two sort of surges that are really bad, and there's nothing abnormal about them. I just get really bitchy, bad. I end up swinging between sort of being really like angry and grumpy and bitchy and like really short tempered to wanting to cry. Like I go from one to the other, and there is no in between. So that's been fun at work. Um, and very recently, I've noticed that my chest is starting to sort of get. Sorry, my nose really itches. Having two piercings in it gets itchy sometimes. Um, that my chest is starting to actually look like breasts and less like manly chest fat, which is nice because I am bigger. I'm not like largely overweight, but I do have like pockets of body fat and whatever, and some of the fat was on my chest, which would be fine, except it doesn't. Oh my god, my nose! I feel so bad. Except it never looked like breasts; it just looked like chest fat on a man. Um, but they're starting to get a very slight, sort of more rounded breast-like shape, which is exciting. So I can't wait for that to develop more and actually start growing breasts. That's what I'm really excited about, breast development. Um, and yeah, that's one of the. I feel like this TV is also really loud. I apologize. um, but yeah, this video is only 5 minutes long, and I have nothing else to talk about. Um, but like I said, this is month one, so I'm not seeing a lot of changes. I haven't really seen any changes in my face yet, which I didn't think would happen. Um, but yeah, I mean that's pretty much everything. There's really, like I said, this is month one, so nothing huge has happened yet. I'm sure sort of down the line I'll have bigger changes. Maybe I'll do like Q&A videos on transitioning. Like put a post on Facebook, on my Facebook or something, or Twitter or something, and do like a question and answers video about transitioning questions. That might be fun. I'm sure there are plenty of other trans people on YouTube who have done this. What I'm doing is nothing new. um, but um, but yeah, so I guess that's it. Um, Hopefully I will be doing other things on YouTube besides doing these sort of like monthly transition vlogs. Um, but the vlogs I think are more for me than anything else. Like if somebody else who is going through the transition, finds these videos and they get something out of them, absolutely wonderful. That's what I could hope for, even if it's just one person. But on a surface level, these are definitely more for me, that I can keep track of what my transition's like, and I can go back and look at it and sort of see where I was and see where I'm going, that sort of thing. But yeah, so I guess that's it for now. Thank you to anyone who sees this and who watches. And I'm gonna sneeze. Maybe. Yep, sneezed. No third. Usually my sneezes come in three. Um, but yeah. So thanks for watching. Thank you in advance for anybody who continues to watch these vlogs and things like that. And if I don't do anything else on YouTube, I will. Until then, I will see you guys next month. Bye.